everybody, this is Dr. Greg Huddy here with Spring Hill Health and Wellness. Today I want to go over just a basic explanation of chiropractic and how it works from my spinal education model here, okay? This is what I go over with my patients. I think it really explains how chiropractic works and how we get you better, how you got bad, and kind of a working model of what works and when. So this here is two vertebral segments. You've got a vertebra, a bone here in the spine, the vertebra, right? You've got a bone here, you've got a disc in the middle, and you've got a bone here, okay? So you've got 24 vertebrae in your spine, okay? Each one has a certain alignment and a certain motion. This one up here this one is in good alignment, that's why they're aligned, and it also, alignment and motion go hand in hand. You can't have one without the other. That's a golden rule, that's fundamental. When you're out of alignment, you get fixated, you get locked up in that joint, and it doesn't move as well as it should. So here, this is good. I hate to use the word perfect, but this person's spine is moving well. The bone's centered right over the disc. All the muscles around there are their normal shape, doing their normal function. The nerves that come out of the holes, you can't see it, are open as wide as possible, and the nerves are firing like they should to the muscles or wherever those nerves go. So here, the person's good. As you lose alignment, you see the bone shifts one way where the disc shifts the other way. This person now has lost some alignment, and now it's not moving as well as it should. Okay, it's fixated. There's a little bit of movement there, but not 100%. If it's shifted this way, let's say it can't go the other way anymore. If it's twisted one way, it won't twist the other way. So when that happens, the muscles kind of tighten up around it. Sometimes there's pressure, little pressure, inflammation around that nerve hole. Okay, the person has lost function in that spine. I use 50%, but again, it could be 20%, it could be 70%. Everybody's a little different level. But lots of times too, getting from here to here sometimes is not a traumatic experience. It's a posture thing. You've been sitting the same way for years. Maybe there was a couple traumas here that knocked you down, but overall, like I said, like I'm right-handed, I do certain ways every day. So again, we all have our habits. So, I may build up a misalignment because I stand on this side of the table, or I use this hand for something a lot, working out or something. So we lose that alignment, we lose that motion, the muscles kind of tighten up around it. This person's usually stiff. They're not in pain necessarily, they're stiff, they know they don't have full mobility, but they're a little bit locked up in the joint. Now, as the person continues down this way, again, the alignment gets worse. Now the disc is really pushed out, the bone's moved over this way. Now this person's not moving, sometimes not at all in this joint. And the muscles around there are in spasm. A lot of times too, this is what the medical doctor will call a disc herniation. When this is so severe, the disc bulges to one side and it herniates. Okay? Chiropractors just see that's a very bad misaligned vertebra. Now that can go from here to here with a bad trauma, like a fall, trying to squat or deadlift 500 pounds, wrong form, or sometimes it's slow going, and then you're just bending over to tie your shoes in bad form, and it's been bad for a while, and you're getting older, and it goes to this level. This usually experiences a lot of pain and inflammation. Okay, it's kind of like grinding the joint, so a lot of fluid buildup, a lot of inflammation. A lot of times too, we see patients that call our office in this phase here. Okay, so when they call our office, we see them, we do an examination on them. I try to find which bone is out. I do x-rays to find out which position it's out, because again, we need to look at both of those. And then we work our way getting that person back up here, okay? Now, a lot of people say, well, Doc, can't you just find the bone, one adjustment, boom, up here? No, we cannot. What happens is usually, unless it's not a big trauma, you've been down for years. The muscles around there have adapted to the bad. See, that's the lag time in chiropractic. You have to get an adjustment and you have to move the bones back into alignment, but the muscles will be used to this physiology, not this one. Okay, so it's a little bit of tug of war. We go up, we go down, we go up and up, go down, up, down. Depends on the spinal, your arthritis in your spine, depends on how old you are, what you've been through. Someone who's 15 years old, not a traumatic life, good posture, good shape, is do a lot better than a 70-year-old who has multiple traumas, played football and rodeo. He's going to be real down. It's going to take longer. Okay, so again, we want to. It's not a one visit thing. okay? And lots of times too, you can be from here to here without any pain, without any symptoms, okay? You just didn't know it. Just like the heart attack is sometimes the first symptom is the heart attack. It's not just about, the pain, it's about function. So here's what I want to talk about too. Here's what I want to talk about answers. I need to wrap this up because Mason's telling me it's going a little long. But a lot of times people, if you do PT, physical therapy, I love physical therapy, okay? But if you do PT on this, it's like controlled trauma. It's not ready yet, okay? That's very important. A lot of people say, well, is it physical therapy good? Everything is good, but a lot of times it depends on the correct timing, okay? PT should be up here once you get the alignment a little better, okay? The flipping upside down, the decompression things where the guy kind of flips upside down, hangs upside down, those are great when you're just stiffing up here. You do that down here, you're pulling that misalignment out, you're training a misalignment in the wrong way. So it's like controlled trauma at that point. Not good. Good up here. Again, everything has its places. Okay? So again too, if you're just massaging the muscle in this area here, you're not treating the cause. So again, we want to get the spine back in shape, back in alignment, back in mobile, the correct motion, back in alignment. And then we also work on the muscles and exercises so we bring it wide up here and it gets stronger. It doesn't want to go back down this way. Okay? So we're going to do more videos about this. There's a lot to explain with this chart. That's why I love it. And I hope you guys get a lot out of it. If you guys have any questions or have any pain or back pain or neck pain or anything, it's always free to come and talk to me. Spring Hill Health and Wellness, give us a call, and we'll see if we can help you, okay? Thank you.